Hello everyone, in this video I'm going to talk about what is cleft of lip and palate, what causes cleft of lip and palate, and the problems faced by the persons with cleft of lip and palate and the role of speech language pathologist in treating them. So what is cleft? Cleft is an anatomical opening which is a congenital condition. So what are the types of cleft? The type of cleft varies in different forms. They are cleft of lip, with or without palate. So what are the causes of cleft? It can be of two factors. They are internal factors and external factors. The internal factors are chromosomal deficit, genetic disorders. External factors are environmental teratogens, folic acid deficiency, vitamin B6 deficiency. So next we move on to problems faced by the persons with cleft of lip and palate. Here comes the role of speech language pathologist. The main concern is towards the speech production and feeding and swallowing. In terms of speech, the person will exhibit more articulatory errors such as compensatory errors and obligatory errors. And in terms of feeding and swallowing, the person will exhibit problems in oral preparatory phase, oral phase and pharyngeal phase. The person will also show hypernasality, cul-de-sac resonance and nasal air emission in speech. After surgical management, it is compulsory to attend a speech therapy session, and the speech language pathologist will provide certain therapeutic approaches to improve speech production in the persons with cleft of lip and palate.